atlas that gives a distinct visual imagery of being a medical professional. It's not really so necessary to be in a white apron, but all the people who are working for relief, for WHO, UNICEF, all the different continents, once they are going in field and working in public health beneficiaries, they will be wearing a white apron. So that gives a clear distinction of you being a healthcare professional. So now people have got a receptivity towards your ideas, your thoughts, your talk. So first is the visual. You are in a white apron. Certain people are there, certain placard is there, or a small standee is there talking about, like in Turkey we had a problem of earthquake. So even Indian team of army surgeons and doctors, they went there and they talked about and they provided the relief work. So now they were having standees which was talking about where they are coming from, and they were saying they are Indian army doctors, they were doing relief work. So that was the first part. So that was the first part of going to public and talking to public about healthcare. The second part is, once we are there, we talk about ourselves, who I am. Like I talk about over here, in your village I have come and I am a public health scientist. In local language we will be saying, आज मैं आपके गांव में आया हुआ हूँ और मैं एक पब्लिक हेल्थ साइंटिस्ट हूँ. आप सबको बताऊंगा हेल्थ के बारे में, गांव के स्वास्थ्य के बारे में, बच्चों के स्वास्थ्य के बारे में, माओ की न्यूट्रिशन का ख्याल कैसे रखें, न्यूट्रिशन की कमी यानी कि पोषण की कमी से होने वाली बीमारियों से खुद को कैसे बचाएं. So I establish myself, who I am. Thereafter I start talking about my knowledge piece that I want to deliver to my audiences. Talking to many people or talking to a crowd, like once we are talking one-to-one, the most critical thing is we are making eye contact. Whenever you are in your clinic and a patient comes to you, you are making a eye contact. Same should be there in a big crowd, but the challenge is you have got a crowd of say 50 people, 100 people. Still you should appear like you are making eye contact. So one is, across the crowd, if there is a big crowd, make sure every location in the crowd you are looking, and that's how you have to move yourself from one point to another point, so that you are able to make eye contact to as many people as possible. Secondly, another very critical task, in a crowd you have to continuously looking whether people are interested in what I am saying or not. For that purpose, sometimes you have to illustrate. People always love certain kind of illustration, example, story. मुझे कोई कहानी बतानी होगी, मुझे illustrate करना होगा. Something from my experience and something that can connect with them. So I should know in brief about cities and places where I am going. In a village I am going, so let's know something about the history of village, talk about, so that they are connected with my idea. Great. Then we make eye contact with everyone and deliver my message. The third thing is, always try to have some kind of question and answer and some kind of response. Even the politicians use this. They will be asking to the crowd, do you want to make India great? So people are answering back, yes, yes. आप सब पूरे गांव को healthy बनाना चाहते हैं, and you seek the response. आप बताइए, बनाना चाहते हैं? They will say yes. So that is the thing. That way there will be a two-way communication, and you will be getting audience and you will be getting response. So with this, we will be giving a small hand to you, and then you will also be practicing. Let's come. Who comes first? Everything is practice. It's all practice. Just staying comfortable with it.